Hi everybody. This is topic 1.3. Just had a little bit of a learning curve. I had gone through this whole unit and already recorded it, only to find out that I had talked too much and the video was too long and YouTube didn't like it too long. So I'm now going to divide it up into the first part will be on bridges, the second part will be on barriers so that I don't talk too long and it actually will upload properly. So topic 1.3, as I said, is on bridges, the first part of it anyways. And the second part you'll get later. So outline, these are the outline or the learning outcomes that are described on Moodle. I'm not really going to go through them. You can read them on Moodle or read them in your handout. So bridges, what do we mean by bridges? Well, bridges are something that connect two things, or bridges are sometimes a thing that makes it easier to connect two things. So the following bridges are strategies we use to connect with our clients. So tactfulness and diplomacy, courtesy and respect, empathy, genuineness, appropriate self-disclosure, and assertiveness. Our words are very powerful, and Louis Nazer says, words of comfort, skillfully administered, are the oldest therapy known to man and provide the best medicine, I would argue. So tactfulness and diplomacy. Disagreements happen. It's how you deal with them that makes them important. So avoid putting others down. Avoid telling it like it is. Use tact and diplomacy instead. Courtesy and respect. Show courtesy, remain considerate of others' thoughts and feelings. Show respect. Value others so that they may feel important to you. Examples. Always address a client in their preferred manner. If they want to be called Mr. Smith as opposed to by their first name, that's their choice. Knock on the door prior to entering a room. Request permission to touch a client, as I discussed in a previous topic. When you convey courtesy and respect, it causes better client compliance, more effective work relationships, and better eye contact. Empathy. Fully acknowledge a client's feelings. Provide support and care within your power. Don't lose self. Empathy is essential for a therapeutic relationship. An empathetic healthcare provider perceives and understands the client's emotions accurately. Empathy is associated with improved client satisfaction and adherence to treatments. What kind of things do we do to show empathy? Well, we engage. We show like we're engaged. So open posture, being attentive, responding appropriately to verbal and nonverbal cues, using good eye contact. Those are kind of things that help with communication skills. Genuineness. People feel you are real. You're not an act. And people feel that. And people are pretty intuitive. They'll be able to tell if it's an act or not. Fully engage. Show them that you are doing the best job possible. Appropriate self-disclosure. Reveal something about yourself to show us similar circumstances to bring closer together. But use this tactic only if it's going to help. Describe only because you recognize that it's parallel to theirs. Mentioned only because it's helping you to understand the other person and have empathy for what they're feeling. However, there's a fine boundary. Appropriate self-disclosure is not saying it for the sake of saying it, or one-upping a client, or telling other people's stories, or removing the client center's focus. It's very, very thin line between the two. Assertiveness. Comfortably and confidently express yourself. People, again, can tell if you're confident about what you're doing. Does not disrespect or produce anxiety in others. Use clear and direct language. Remain relaxed and respectful. So all of these are interventions that promote effective communication. So remaining silent with a patient. Talked about this in topic 1.1. Gives them a chance to gather their thoughts. Remaining non-judgmental. Your responsibility is to assist the client in managing their healthcare, not to approve or disapprove of their beliefs. Show acceptance of what the patient tells you. Nonverbal behaviors like body language, facial expression, and eye contact, as well as small verbal cues, tell a huge message and will show that whether you've accepted it or not. Giving recognition, positive reinforcement. Positive reinforcement is great. Offering of yourself. You must always make it clear to the client that your primary responsibility is to help them. Giving the patient an opening. Asking open-ended questions, as we discussed earlier. Leading the discussion helps to get the story that you want told out. Making observations without appearing to be judgmental. You should be ready to make your perceptions of the client and their condition known. Encourage communication. Always ask the client to make explicitly clear what they're feeling. Never assume. Ethical principles in therapeutic communication, and it's not just in therapeutic communication, I would argue in all of healthcare. Respect for all people, regardless of difference, so equal treatment to all. Autonomy. The client decides what is right for them. Confidentiality. Always protect their information. Mutuality. Constant negotiation between client and professional. You're working together as a team. Collaboration works with clients. Honesty. Truthful statements with congruent verbal and nonverbal communication. So important. Informed consent. Clear information about intervention. A client makes the final decision. And client-centered care. Based on a deep respect. Obligation to care on client's own terms. Client known in context of their social world. They come with baggage. They come with a history. We have to take that into account. Healthcare providers facilitates involvement of client in their own care. Outcomes. If a client feels like they're involved in their care, they will feel known, respected, engaged, knowledgeable, and less stressed about their illness. So these are bridges, and now the next little video is going to talk about barriers.